My name is Brant Schumaker. I am an associate professor in the Department of Veterinary Sciences. I'm an epidemiologist by training, and I've been here since 2010 working as an epidemiologist at the Wyoming State Veterinary Lab. So COVID-19 is one of the most infectious viruses that we have had recently. And the reason why it is so critical for our community is that we have had no experience with it before. And what that means is we have had built up no immunity as a population. We don't have a vaccine. And so when this sort of virus comes into our populations, it's able to transmit pretty readily. It has about twice the infectivity of the flu virus and certainly is much more deadly. What we're finding more recently, and this is what's so critical for our young populations on campus, is that in populations that are even asymptomatic, a large percentage of those individuals are still seeing major health complications, including a large percentage which are seeing inflammation of heart muscle, some of which are really, really severe to the point that a healthy individual that is asymptomatic could potentially suffer major consequences associated with this disease. The important thing to note is that we're not talking about 5 individual cases. We're talking about 5 symptomatic cases in the course of a single day. So what we've seen recently is that we were not having hardly any symptomatic cases over the course of the summer. And during the last week, we saw a massive uptick in the individuals that were not feeling well reporting to student health services for testing. We had 4 cases on Monday of this past week. We had 4 cases on Tuesday with an additional asymptomatic case. And then we saw 7 symptomatic cases on Wednesday when we went into our pause. So we're really talking about 15 cases over the course of the first 3 days of the week. And what we think that means is that because a lot of our young people don't show symptoms, we're likely seeing a grand total of cases about 4 times that number. And so that's kind of why we picked that number. Ultimately, we can start seeing an outbreak take off. This is the tip of the iceberg. And that's why we want to be really conservative so that we have the ability to find all of these cases and contain them and actually keep the university open for the course of the semester. When it comes to what we feel comfortable with at the University of Wyoming, there is no zero risk proposition associated with disease. At the same time, I think it's really important to note that when we get into the hundreds of cases, we're really approaching a situation where we might start seeing deaths on campus. Some of these universities have been lucky. That's not something we're willing to do at the University of Wyoming. We don't want to put our student and staff and faculty's lives at risk and try and get lucky associated with this outbreak. So we're trying to come up with what we feel is reasonable and try and have a nice balance between in-person instruction and activities that we all know and love and appreciate about our university, while at the same time trying to mitigate our risks of seeing major problems associated with this disease at the same time. COVID testing is a building block, and it's actually one of the most important factors in our ability to understand what's going on with an outbreak and be able to control it. So we test in a number of different ways. The gold standard for testing is to do surveillance, where we look at every individual in the population. And the best modeling that we have says that we need to do that 1 to 2 times per week in order to find the level of cases and contain them before they become an outbreak. In the absence of our ability to get that surveillance system set up, we've gone to this phased opening approach. And we are doing bridge testing, which invites every individual as part of this phased testing approach to submit 1 sample each week to our bridge sampling program. That tells us that we have an ability to determine what kind of level of disease we're seeing, to find people quickly, to find their contacts, and then we can isolate infection and not see a massive outbreak. And then the final piece of testing is this symptomatic testing. So individuals outside of our surveillance that are coming to student health services or their primary care practitioner to get tested because they're not feeling well. And again, we mentioned this is associated with probably a fraction of the total number of cases because there's a large percentage of asymptomatic people that are still capable of transmitting this virus. All told, we're trying to find ability to find all of the cases, to contain them, and then to make sure we're not seeing extra infections so we can keep campus open. We are coordinating our efforts for contact tracing and getting these laboratory data. We have a release signed for any of the tests associated with the university that we can have access to those results. And then we're also able to have access to individual test results associated with the university through agreements with the State Department of Health. We certainly take all of the precautions to make sure that these are confidential situations. We're not going to have individuals that have their confidential medical information compromised at all. But we need to know this data so that we can find individuals and make sure that we're able to keep the rest of campus safe and healthy. I'm part of a small group of individuals that meets daily to discuss the current data and also make recommendations to the president on what our status needs to be. We have emergency meetings when a situation comes up like this number of symptomatic positives that went into a pause. And the president has been heavily invested in those meetings, oftentimes participating daily with us. So our goal is to provide the president with the best data that we have, the most up-to-date picture of what's going on the university campus, as well as in the Albany County community, and to give him guidance on what this means in terms of the overall picture of COVID-19 for our campus community. There is nothing that the university administration, myself, or anyone else can do to keep campus 100% safe. The goal of our program is to give us the opportunity to remain open and give us the best chance of doing that. However, the success of any of our efforts rests on individual behavior. So when we think about that, what happened with the pause is individuals were not following our guidelines. Individuals that weren't feeling well were in contact with large numbers of individuals, and they were not practicing socially responsible behaviors. So we had no social distancing, a little mask wearing, and things like that. And we saw this situation occur. This upcoming Labor Day weekend, it is critical that the members of the university community practice our responsible guidelines, that we use masks, that we practice social distancing, that we do not attend large gatherings. If the university community can do that, I think we have a very reasonable chance of reopening. If individuals don't, I think we're probably headed toward a situation where we're not going to be able to reopen. So really, it's up to our campus community to be responsible in order for us to reopen.